Don't give up hope. These are hard times. We know they're going to continue. Ohioans are digging deep on this, and we have resources to help you.
For the latest on COVID-19, visit WHBC.com.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and of course our socially distant technical producer. Thank you to our special guest today, Barbara Frastaschi, Bachelor of Science in Nursing, RN, Administrative Director of Mercy Offsite Rehabilitation. So, Barbara, welcome back to the show again.
Okay, well, good morning, and thank you for having me back on the program.
Like so many aspects of our lives, COVID-19 has changed everything. Today we will talk with Barbara about the importance of resuming health and wellness visits in the safety of our hospitals and moving forward with elective procedures. All of our programs are also available on our podcast. Choose your favorite podcast app and search for Health Matters with the Medicine Center Pharmacy, and you can take our programs with you anywhere you go. If you have questions today, you can post them up on our live Facebook feed. And with that, we'll get on with the show.
So, Barbara, welcome back to the show again.
Okay, well, good morning, and thank you for having me back on the program. A little bit about me. I've been in healthcare since 1977, having graduated from the University of Cincinnati College of Nursing and Health. And I've worked in a variety of healthcare fields, including nursing education, administration in areas of wellness and rehabilitation. I've done consulting, and most recently, urgent care and occupational medicine. I recently completed my master's in healthcare law. I'm married to my husband, Marcello. We have 4 children and now 7 grandchildren. So that's a little bit about me.
Okay, interesting. Well, it seems like we've been living under the cloud of this pandemic forever, and the reality is it's only been 8 weeks or so. And in that time, everything has changed, like our pharmacies. Mercy Medical Center's priority is the health of their patients. The first step in moving forward is having confidence in the safety of our facilities. Can you tell us what Mercy Medical Center is doing to keep their facilities safe for patients?
Well, of course, Paul, our patients can be assured that our main hospital, as well as our 10 health centers and physician offices, are following enhanced cleaning and sanitizing processes in accordance with the CDC guidelines. Our waiting room seating at all of our facilities has been rearranged to ensure proper social distancing. We ask that all patients wear a face covering or mask during their visit. If they come in without one, we offer them one. We also ask that all patients come to their visit or appointment alone if possible. We have hand sanitizer conveniently located for all our patients to use at any time. And also our employees are practicing proper hand hygiene, wearing masks to protect our patients and themselves. And we always want to remind our patients that proper hygiene is critical in order to stop the spread of infection. At our main hospital, we are also screening all patients that come in with their temperatures being taken, and also at our health centers in an effort to protect the patients and employees. Our patients' health and safety continues to be our number one priority as we navigate this pandemic. Also, our staff is taking their temperature twice a day and logging it, and they cannot work if their temp is 100 or greater. So we make sure that not only our environment, but those in our environment are safe to protect our patients.
What about a picture, I think it was in the newspaper not too long ago, of the robots that you've got cleaning the rooms, the halls, that sort of thing. Have you named them yet?
We do, and I cannot for the life of me remember the name. I think the last one was named Scott. I do remember that. But we do have 3 Gen X robots that are utilized throughout the hospital in our ICU rooms, in rooms in which COVID patients were, staying. And also recently we went through the entire OR area to make sure that all traces of any viruses are destroyed before we start that area back up.
So how do they work? Is it ultraviolet light, or it can't be a fluid?
No, it's not a fluid. It is ultraviolet light, so everything that is in the room, everybody gets out of the room, and it's a pulsing light that goes around the room and destroys all the viruses.
So it's not safe for anybody to be in the room with them?
No, nobody's in the room when it's working.
Do they, you see these vacuum cleaners that are on the floor, these robotic vacuum cleaners, these little flat things, Do they function on their own, or are they directed by a remote device?
I have no idea. I don't have one of those. But I think once you turn them on, they kind of bounce all over the room and must just go and pick up things as they, as they travel around the floor.
I see. Interesting.
Yeah, but
okay.
They're not. I don't think they're ultraviolet. That's just like a sweeper. If I'm thinking of what you're thinking of.
Yeah. I just thought it was a very interesting concept, and it probably gets to places that humans can't get to places. So.
Yeah, probably under those couches that are pretty low, maybe.
Sure. Okay, so from emergency rooms to stat cares to outpatient health centers, what is open and what kind of restrictions are in place?
Well, our emergency rooms and our stat cares have remained open throughout this time. Again, if you're coming to the ER stat care, patients will be screened and offered a mask if they don't have one. The restriction is we really do want to keep the number of people down in our sites, so we ask that they come alone, but many times when someone is ill, you need someone to bring you, so we ask that it just be one person that come with the patient. In our other areas, like if they're coming into a health center as well that has, let's say, the therapy or cardiac services or the sleep lab or primary care offices, we also take their temperature as they come into the building. Anybody that does have a temperature, if they're going to a site like therapy or cardiac rehab or sleep lab, if they have a temperature of 100 or greater, we do send them out and tell them to call their PCP. We're not having anybody come in for a well visit that has an elevated temp. Of course, if you're coming into the emergency room or to the stat care, you probably are sick and you do have a temperature, so those patients are permitted into the area. But then everybody is notified that we have perhaps somebody with a temperature, and if they also have respiratory issues, then we address those immediately and get that person, and at least in the stat care, we put that person into a room where they can be taken care of quickly and out of circulation.
As the hospital embraced these infrared forehead thermometers, people are asking me, are they not accurate?
Well, that's very interesting because right now it's very difficult to get thermometers, and we have a lot of temporal thermometers that we use, but we also have 2 infrared that we are using in a couple of our sites. The one site is really not thrilled with it, doesn't feel that it is taking accurate temperatures because the air in the room. So if a door opens and a rush of air comes through, then it might alter the temperature that you're taking on a person perhaps. So it's we're still kind of working through all of that. One person that is using it likes it very much, doesn't have a problem with it. Another site is not as thrilled with it, but we're hoping that we're getting accurate temperatures.
Interesting.
Yeah.
So I understand that elective procedures have procedures. How do you prioritize these?
Well, what's happening is for us with the elective procedures, all of those procedures that were canceled due to COVID, our surgical committee is reviewing all of those, and any patients that were canceled we'll be hearing from the team and in the next few weeks, and they're going to be rescheduling them. So before they put on other surgeries, unless they're emergent, they're going to go back to those patients that had their surgeries canceled. So that's how they're prioritizing those right now.
Has there been a rush to the stat cares? A lot of patients going to cares.
Well, no, I would say no. There's not been a rush. Our numbers are probably half of what they used to be. We are now also doing telemedicine that we started in April, so that's kind of picked up. But we are still seeing patients in our stat cares. but I wouldn't say that it's a rush. I think people are being mindful of the shelter at home, of calling their PCP and those kinds of things. So the ones that do come in are not feeling very well. So we're addressing this.
Telemed's here to stay.
I think telemedicine is here to stay. Right now, because of the COVID issue and because of the President's emergency declaration, this really came about very quickly, and it was added to our toolbox to care for patients and to also protect those who are vulnerable. So, we have Medicare and Medicaid paying for these, and then following suit were the insurance companies, which was great. So I think it will be here to stay, but I think it'll probably be tweaked. Right now, it's kind of a free for all in terms of, if you need to use it. But I think eventually it'll be tweaked a little bit. That's just my personal opinion.
Okay, Barb, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters.
You are muted.
Brad and I are talking to BSN-RN of Mercy Office Patient Services. Posted on live Facebook. Sorry, there, Barb.
Yes, I'm here.
Okay. What should patients and their families go to Mercy?
I'm sorry, I didn't hear your question there, Paul.
Okay. What and there is no any state for it.
Okay. What our patients and families should know before they come is that we request that they come to the facility alone if possible, that they wear a face mask or face covering when they enter a Mercy facility, that they're prepared to be screened and have their temperature taken so that they're not, don't be afraid. We're just going to do a temporal temperature on you or infrared one. If you do have COVID symptoms or you think you've been exposed to a COVID-19 patient or you have a fever of greater than 100 and you're coming in for a procedure, it is best to not keep that appointment and to call your PCP. So we don't want people that are sick coming into the building for an elective procedure such as the like a sleep study or for therapy. If you're coming into the STAC care or to the emergency room and you have a fever, that's perfectly fine because you're coming because you are sick and those areas will take care of you. But you should let them know right away that if you've been exposed to somebody or you suspect that you have COVID or you're working in a facility where there are some people that have been exposed or have come down with it. It's just important for people to know that.
How about?
I think go ahead.
How about the symptoms of COVID? Can you relay those?
Well, the symptoms have been increasing as we've gone along with this virus, but some people have fever, some don't, and it can be a low-grade fever of 100 to 102 or greater. People have some shortness of breath. They complain of a dry cough. We've now seen some patients that have GI disorders with it that wasn't first recommended or wasn't identified. So there's a whole list of symptoms, but the most important ones or the most serious ones are the shortness of breath or difficulty breathing. And those are the ones that we want to address right away.
Thus the need for all the respirators they're talking about, right?
Right. That was critical because then the pneumonia develops, and then for some of those individuals, yes, they do get put onto a vent. Yes.
Okay.
All right, Barbara, the media has emphasized the need for families to social distance while their loved one is being treated or having surgery. This is a significant concern for many families and listeners alike. How does Mercy handle these situations to keep the family members informed?
That is very true, Brad. Right now, Mercy Medical Center, along with all the other local hospitals, really have no visitation policy for the safety and protection of our patients and employees. We encourage patients and families, though, to stay connected virtually via cell phones, hospital phones, tablets, or computers 24 hours a day. We know that this is a difficult time both for the patients and their families and friends. I had a sister-in-law in the hospital for 9 weeks, and out of that 9 weeks, 8 of those weeks there were no visitations. So it was stressful. It wasn't a COVID issue, but still it was very stressful that nobody could visit her. So keeping in touch via FaceTime, phones is also very important. And our providers and our nurses do a very good job of helping patients Zoom with their family members, do Skype or FaceTime. So that's been very helpful so that they can stay connected. We know how important it is to the healing process, and our employees want to make that happen in every way possible while still adhering to the requirements by the CDC or our local health department and rules that we have.
Yeah. It seems as though COVID-19 has increased awareness and almost an urgent need to use telemedicine. We touched on it earlier, but can you explain what telemedicine is to a patient?
Sure. It actually is. It allows the patient and the physician to have a virtual visit, meaning they can either visit over the internet, over their iPhone, over their computer, or sometimes it's just a telephone call. So it's a visit between the patient and physician, in which both parties can, see each other or talk to each other and talk about the issues that are taking place and whether or not there's treatment that needs to be ordered or not. So our primary care physicians have been using this very successfully for the last several weeks, and we just started using it in the Stack Cares in April. It does provide security for the patient that is at risk or is vulnerable to COVID and being out in the public. By utilizing this, it protects the patients as well as decreases the community spread of the virus. So patients can also expect that their virtual visit is protected and confidential.
Well, it's really kind of neat to be able to have an extra way to access care in a pinch. I mean, much like this morning, even though we've had a couple technical hiccups, you didn't have to drive to the radio station and spend maybe an extra hour out of your day, but to be able to hopefully get care quicker is I think exciting, and I hope it's something that can be revolutionizing healthcare in addition to increasing the level of care that's available to patients. What kind of conditions or symptoms are recommended as being treatable for telemedicine?
Well, telemedicine is appropriate for issues such as allergies, coughs, colds, flu, infections, insect bites, sprains, some GI symptoms.
You are unmuted.
They can all be evaluated virtually. Also, follow-up visits. Let's say the person had surgery or had a visit with their physician a few weeks ago and he wants to follow up with them. A virtual visit is probably appropriate for that follow-up. So the patient doesn't have to go out into the community and can, in the convenience of their home, talk to their physician. Any type of emergency situation would mean a call to 911 or a visit to the emergency room. But a virtual visit is very, very helpful for many people at this time, and especially those who are most vulnerable and at risk, which is our elderly population.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
The Half Off and Out by Store in Louisville is open. That's right. It's open, and it is really open. Usual hours. We've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need Sea Glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station. News Talk 1480 WHBC.
Here's your AccuWeather forecast. Breezy day. It'll be cloudy with a couple of showers and maybe a heavy thunderstorm around this morning. A strong thunderstorm this afternoon. That could bring some hail and damaging wind. High today 75. Cloudy tonight and tomorrow. Low tonight 55. High tomorrow 76. Clouds and showers. A thunderstorm on Sunday. The high again at 76. Clouds with a shower. A thunderstorm Monday. The high 69. I'm Steve Williams for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Talking to Barbara Christoschi today.
Okay, Barb, who staffs telemedicine and how safe is it?
Well, Brad, our providers in the STAT cares and our primary care physicians are the ones that staff the telemedicine. So telemedicine that is used for STAT care and for the professional corp here at Mercy are our own physicians. It is not outsourced to some other entity. These are Mercy providers that they're actually on the phone with or on the computer with the patient. In terms of how safe it is, telehealth technologies really help to increase a patient's adherence and access to care, so it is safe. It's been around for a long time. It's been used in rural areas far more than it has been in these kinds of areas, in urban and suburban areas, but it has been around and it is safe. Providers always have the ability to have the patient come in too. So if they're talking to their patient or they're seeing the patient, even our STAT care physicians have sometimes identified that they're not comfortable making the diagnosis over the internet or over the phone. So they'll say, I really wish you would come in. I'd like to see you because I think it needs more testing. I need to actually see you. And the patients seem very understanding of that. But the majority of the time, they can diagnose and treat, and they're comfortable doing so.
Okay, here's the big question for you. Does telemedicine replace our family doctor, or do they communicate and share patient history and other information?
Well, in terms of Mercy, it does not replace your family doctor because your telemedicine person is your family doctor. It is your own PCP and provider that is caring for you. So, no, it does not replace your family physician. And is there information that is shared? Well, with them doing their own patients, their information is going right into the patient's chart. So that information is there. In terms of our STAT cares using it, we do share that information then with any primary care physician of the patient that we are seeing. So that information is shared with the primary care physician that the patient does have. But other than that, it is protected information.
How do the insurance companies look at this? I know this is relatively new in our area. Is this a billable situation?
Well, I think that the one good thing is that under the President's Emergency Declaration, CMS expanded this benefit on a temporary and emergency basis under the I think it's the 1135 Waiver Authority and the Coronavirus Preparedness and Response Supplemental Appropriations Act. So that's a long name, but it was approved because of the emergency declaration. And because of that, CMS said, we want our vulnerable patients to be seen and cared for during this time, and they can't go out. We don't want them going out, so, we're going to pay for these visits. When that happened, and all the other insurance companies saw that what was taking place with Medicare and Medicaid, and they usually follow suit, they all came on board and agreed to pay for these visits. So yes, insurance companies are paying them. So we'll just have to wait and see how the reimbursement goes, since it is also new.
It might be a little early to ask this question, but how does is this improving patient outcomes, do you think, or
in terms of our statistics, I would think that it is a little too early to tell. We've only been doing this for about, the 8 weeks in terms of our primary care. But I would think they would have good outcomes because they have patients that are being in contact with their physicians. We do know from other studies in other areas that it is a positive thing. They do have good outcomes. They do have good adherence. Patients follow through because they have contact with their physician in a convenient way. It kind of removes any hurdles such as transportation and those kinds of barriers. So it does allow the patient and the physician to communicate more frequently or better, which improves their outcomes. We do know that it is a high patient satisfier. So, many times when you have patients that are satisfied, you have patients that adhere to directions. So that's where we are going with this. And I think time will tell that this is a very good tool in our toolbox for caring for our patients.
It seems to me that it would, just talking to somebody, whether it's over a computer screen or face to face, that it would in fact improve conditions. At least the sense that the patient, I got to talk to somebody and they told me that I'm going to be okay, or they told me that this is what to do, or
I think we could touch on how telemedicine is good for our community. One of those things where it does improve access to care, and we often see patients in the pharmacy that unfortunately when they come in, they don't have access to care. It's one of those things that's a real concern. When they have a medical condition, we kind of don't know sometimes what to do about that. So it's nice to be able to hopefully have something like telemedicine where maybe they can get some care that they don't have.
Just being able to talk to somebody, a physician or a nurse or whatever, can allay an awful lot of fears. And, I'm sure this is not an instantaneous, hey, I can dial in and talk to the doctor, but at least it probably in this time is a lot easier to do that than it is to make an appointment to see a doctor.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The Half Off and Out by Store in Louisville is open. That's right. It's open, and it is really open. Usual hours. We've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to our program this morning, and you are listening to Health Matters with the Medicine Center Pharmacy. I think for the past 8 weeks, almost everything has stopped. Speech therapy, occupational therapy, physical therapy. How do we return to normal here?
Honestly, Paul, I think patients should feel comfortable. I know that our therapists have been planning for this, and they're very anxious to see their patients again. They've taken every precaution to make sure that they themselves are well and that their clinical facilities are sanitized. All of the areas are setting up appointments so as to not have too many patients in the clinics, so that social distancing is maintained. We are, again, taking temperatures of patients prior to their appointment coming into the setting so that we know that they're well. Mercy has even moved their outpatient therapy clinic that was in the hospital on the 4th floor to our North Canton Health Center so as not to increase traffic of well patients coming into the hospital where we have sick patients. We have really done a lot to make sure that our patients are safe when they come into our facilities. And we know that returning to normalcy is a slow process. And we're not jumping in with both feet in terms of opening up our doors and saying, we're back to normal. We are doing this in a very methodical way, bringing patients back slowly. And then as things open up more, we'll increase that. But we're taking this slowly and doing it according to the CDC guidelines for safety, because we have our patients' best interest at heart, and we want to see them do well. We don't want to see people get sick because they're coming into our facilities. So we're doing everything that we can to provide that safe environment for our patients and for the staff as well.
You know, we have a new tenant in our shopping center in Louisville, Concord Physical Therapy, and it sure appears to me like they've had to pull back some, and I would suspect that a lot of the patients are not wanting to come out and you know, in any environment like, you know, therapy and stuff like that. Is that the case with the hospital? Or
we've had, I think we've had some. We've continued on with therapy for those who had to have therapy. It was very important for them to have therapy. Perhaps an orthopedic surgery that had to be done. It's very important for that person to get therapy. So if they could come out, they were seen. But then again, the importance of safety for that patient was maintained. We also recently learned that you can do some telemedicine over the phone with patients for physical therapy and OT. Speech is kind of difficult, but they can do that. So, you know, if you have they had a patient that they've been working with, they could do that. Now we haven't done telemedicine with our therapy patients, but that's certainly something that has now come into our attention that is possible. But hands-on with your patient is really the best for physical therapy. And again, because they're not bringing everybody back, and there is, social distance maintained, the patients are safe when they come into our facilities.
It's probably safe to say that your facility in North Canton is pretty well closed down, right?
No. No, our facility in North Canton is quite busy between, we still have lab that is working. We still have diagnostic procedures going on in terms of x-ray and imaging. Our occupational medicine is out there, so they are very busy right now seeing patients and doing DOT physicals. People are getting back to work, so they're busy. Therapy, our fitness center is down. We are not open. Our fitness center is closed at North Canton, but there is still some therapy going on. And of course, our stat care has been opened. All of our stat cares remained open.
Okay. I wondered. I know you have a pool up there, and
yes, that has not been opened, right? Yeah.
I'm sure that was very busy before all this Corona thing came along. So.
Oh, right. But it's it's open though. It's not closed down.
Okay, that's super. Okay.
Barbara, if listeners are concerned about returning to general health and wellness visits, how would you help them understand the importance of maintaining their health visits?
Well, I think maintaining your health appointments are just as important as ever today as they were 6 months ago. Nothing replaces your relationship with your physician. So I think I would like to say that Mercy has not left any stones unturned when it comes to providing that safe, quality care for our patients. And in keeping a well visit allows for that occasional telemedicine visit too that makes the patient and the physician feel comfortable. And when I say that, I mean, if you have that relationship with your patient, if you're your physician and you're going in for your annual physical and you do see him occasionally for issues that do come up and you use a telemedicine, then he knows you. And so when he sees you over the video or talks to you, he has a better idea of what's going on. So keeping your visits with your physicians are very, very important. I strongly recommend that.
So should listeners be prioritizing their health and wellness visits, and what guidelines might you offer to help them?
Well, I think that, in terms of, whether or not you're supposed to be going in for your well check now, it depends on what your conditions are. If you have no medical issues right now going on and you want to delay your well visit, I can understand that. But if you're a person that has comorbid conditions such as diabetes, hypertension, cardiac problems, you want to keep those appointments because your physician can do some testing. You may want to look at your medications, make sure things are going the right way for you so that you're not developing a problem that is not being addressed. So I would say that those are the individuals that should look at their wellness visits and prioritize them. Or if you're having a problem, let's say you are on antihypertensive medications for high blood pressure, but you've noticed you're getting a lot of headaches or you have some dizziness. Perhaps your medication needs adjusted or something else is going on. So you want to see your physician for something like that, or you have swelling in your legs and ankles, or you have pain or lumps and bumps that you've never had before. Those are the kinds of things that, you really want to make sure that you get addressed. Or if you're a female and it's time for your mammogram or your Pap, you want to get those things done. You don't want to put those kinds of things off. It's important to take care of yourself as well. And making appointments and making them maybe a couple months out from normal is okay if you're well. But if you have comorbid conditions or issues that you're dealing with, it's good to get in and see your physician.
Interesting. So is there a focus on limiting procedures to preserve both PPE and resources for potential rebound and coronavirus cases? We are seeing, and I don't know what the hospital is seeing, but we are seeing a greater supply of available things like hand sanitizer, and masks and gloves and all that sort of thing.
Right.
Whereas things were pretty tight there for a while. So what's the hospital's thinking on this?
Well, actually, the leadership at Mercy has been very focused on PPE inventory, all of our inventory, and the potential need for this, especially with the OR opening up and procedures being done. So we have, from the beginning, monitored all of our usage. We follow the CDC guidelines with regards to the use of PPE and N95s. Our incident command system, along with our supply chain, monitors our usage, and they have continuously built our supply up since the COVID virus has hit. We're very aware of what we have on hand, what we need, we are preparing for the future, and I think in general, we'll be ready for what comes down the road, because we're looking at this very seriously. This has been something that we've always monitored in terms of some disasters, making sure we have the PPE that we need.
So has the respirator thing, tightness, is that cleared up? Are there plenty?
For us, we were very well, taken care of with regards to that. We had enough ventilators. We've always had enough ventilators, so we've done very well with that. In terms of our N95s, we're good with that as well. Yeah.
Good. That's very good. Any thing you have to say here? We're going to close out in about 2 minutes. Okay. What can you tell?
I think I would just like to say to everybody that we need to remain calm, and people should watch the news, but just watch a little bit of it and then turn it off, because I think we have to use common sense through all of this, and it's good to get out and get some fresh air. Maintain the social distance, but wash your hands after an activity, eat healthy foods, get some exercise, and know that we're going to get through this. You have two hospitals here in town. We have great people that are working very hard to maintain the quality of care for the patients in our communities. And, we have to remember there are more people that have survived this virus than not. So, stick with your gut and your common sense. Contact your physician if you have questions. Mercy is here to answer those questions, and we're here to care for people. So that's all I'd like to say, but I thank you for this opportunity.
Okay. Well, good. I'm glad you could come on. I know you're busy. I know everybody's busy at the hospital. So thank you to our special guest today, Barbara Frastaschi, Bachelor of Science in Nursing, RN, Administrative Director of Mercy Offsite Rehabilitation. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and, of course, our socially distant technical producer. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
Good morning, you're on WHBC.
Get the podcast at WHBC.com.
Reopen for retailers, City of Canton, and we have Mayor Tom Burnaby.
Good morning, Canton.
Provided by News Talk 1480 WHBC.
Pam, good to go shopping. Now that we're reopening the economy, which is very, very important, I have to just urge people to please follow all health protocols, even though we're getting into this phase of reopening the economy. And all I can tell those who want to walk around and not wear a mask, hey, if you catch COVID-19 and if you give it to grandma, you will never, ever forgive yourself. Keep social distancing. Please wear a mask when you're in retail situations and in other public situations. At least keep your 6 feet distancing, and please sanitize, and please follow all of the health protocols. It is critical, critical, critical. We have not won this thing. Again, shop until you drop, and I urge everybody in Canton and Stark County to please stay safe.
Get the podcast at WHBC.com.